Normal stool is soft, firm, and brownish in color with a peanut butter-like consistency that prevents any strain or pressure during bowel movements. Any change in this texture, color, and consistency of feces is regarded as anomalous, and loose stool is one of them. Loose stool can occur due to minor causes or severe underlying conditions. Normal bowel movement has about 70% water. Any increase in the water content is abnormal. Even though diarrhea is a condition marked by loose stool, all instances of loose feces cannot be termed as diarrhea. A diagnosis of diarrhea can only be made if a person experiences more than 3 instances of loose watery stool in a single day. Causes of loose stool. Some of the common causes of loose stool are listed below. Infection by pathogens. It is considered as the most prevalent cause of loose stool. Infection by viruses, parasites and other pathogens can cause loose bowel movements. The most common is viral infection resulting in loose bowel movements, typically due to rotavirus, norovirus and adenovirus. Loose stool due to viral infection can last from 3 to 7 days. Bacterial infections that result in loose stool happen due to food poisoning, and can also include symptoms like severe abdominal pain, vomiting and fever. Parasites also cause loose bowel movements due to contaminated water. Medical conditions. A number of inflammatory bowel conditions like ulcerative colitis, IBS/irritable bowel disease, and Crohn's disease, etc., can cause abnormal bowel movements. Patients may experience loose stool that is not diarrhea, or frequent diarrhea. Black loose stool is often a symptom of varied health issues, which need medical examination. Conditions that affect the organs responsible for varied absorption and digestive processes may also cause loose feces as a symptom. The most prevalent of such disorders include gallstones and liver diseases. Again, this requires medical diagnosis. Food intolerance. Exposure to allergen foods can cause loose stool in people with intolerance to such foods. It typically affects people with conditions like celiac disease, gluten intolerance, and lactose intolerance, etc. Loose bowel movements and other abnormal symptoms occur because the intestinal system in such people cannot process these foods. Sometimes, diarrheic stools can also occur as an allergic reaction in people with food allergies. Malabsorption syndrome. It is a condition marked by the inability of the gastrointestinal system to absorb water and nutrients. This can result in greasy loose stools that float. Other causes. Loose stool can occur due to psychological disorders like anxiety, depression, and elevated stress levels. Being on a liquid diet can cause green and yellow watery bowel movements.
Treatment of loose stool, home remedies. Most cases of loose stool are mild and can be resolved by home remedies, as listed below. If loose feces is caused due to food intolerance, then patients need to avoid those foods. Opt for alternative medications, if it occurs due to use of certain drugs. Drinking fluids do not worsen diarrhea. In fact, intake of fluids helps decrease the frequency of loose stools as well as recover the electrolytes that are lost due to diarrhea. Drink fluids like ginger tea or cinnamon tea, soups, broth, soy or rice milk, and fruit or vegetable juices. Drinking fluids can also help prevent dehydration, especially if infants are affected by loose stools. Lost salts can also be replenished with electrolyte solutions if watery bowel movements are frequent. A brat, banana, rice, applesauce, and toast, is considered to be the best foods that can be eaten during watery bowel movements. It is a diet of bland, low-fiber foods that offer energy without exerting the digestive system. Bananas have a balanced level of nutrients that can help firm loose stool, applesauce has the natural bulking agent pectin, rice works as filler and slows down the creation of loose feces, and toast absorbs excess stomach acid. Other recommended foods include plain noodles in small portions, boiled and mashed plain potatoes, strained squash or carrots, white pasta, and saltine crackers. Certain foods can worsen a case of loose bowel movements. Hence, avoid the intake of fried foods, fatty foods, caffeine-rich beverages like tea, colas, high-fiber veggies, citrus fruits, nuts, spicy food and alcohol, when you are getting treated. Take steps to effectively manage and lower stress levels. Take adequate rest and avoid all forms of strenuous activities as it can aggravate loose stools and prolong its duration. Apart from the herbal remedies, an OTC medication called loperamide, a common brand called Imodium, can be helpful in treating loose motions, by reducing their frequency and make the stool firmer. Loose stool, if it persists for more than 2 days, need to be checked by a doctor who will prescribe medication according to the causative factors.
If you find this video helpful, please like it. Share and subscribe to the channel, Health Destination. Thanks.